Okay, today we're going to talk about getting a good night's sleep and insomnia, basically. The objectives, we're going to talk about the causes of insomnia. We're going to discuss how insomnia is related to chronic illness. We're going to learn some techniques on how to get a better night's sleep. And we're going to talk about some medical interventions that can help you with your insomnia. What is insomnia? It's difficulty initiating sleep, maintaining sleep, or having non-restorative sleep for more than 1 month. And what we're really looking for is to see if this insomnia is interfering with your daily life. Are you drowsy during the day? Is it interfering with your work? Are you calling in sick to work? Are you getting up late and being late for work? Or just feeling terrible all day? Who's at risk for insomnia? Shift workers. If you tend to work the night shift, which would be say 11 to 7 at night, you're definitely more at risk just for heart disease, obesity, and diabetes. First responders, people who travel for work, and teens with early school schedules. There's a lot of research about starting school later for these teenagers. They're getting up at 5:30 in the morning to be to the bus at 6:30. They need 9 to 10 hours of sleep a night, and they're definitely not getting that. Caregivers are at risk. Think about if you had young children, you always had an ear open for the children. Same thing happens with when you may have somebody with Alzheimer's in the house or somebody who's ill who you may need to be caring for. If you're working long hours, if you have more than one job, if you're working till 11 o'clock at night, know you have to get up for 7 o'clock in the morning, you're going to be thinking constantly about being sure that you're not going to miss that alarm clock and your sleep is not going to be restful. Some people take meds to fall asleep. You may be taking medications to keep you awake during the day. People with ADHD is an example of this. They take a stimulant during the day and they may need to take another medication at night to help them go to sleep, and it becomes a merry-go-round of medications. Abusing alcohol or drugs. Alcohol is a depressant, and it can cause irregular breathing when you go to sleep, and it puts you more at risk for sleep apnea if you're not getting enough sleep. Medical conditions that may interfere with your sleep, undiagnosed as stress, anxiety, and sleep disorders. Other medical conditions may be you may be in pain. You may need to look at, can I do some stretches before I go to bed? Is there some pillows that I can use to support me? Maybe do some deep breathing before you go to bed to help relaxation and try to manage that pain. Anxiety, again, you can use some relaxation techniques. Menopause. Many women complain of not being able to sleep during menopause, and that's a time when many people do learn about yoga and about relaxation and stress management techniques to help them go to sleep. Caffeine is a product that can definitely interfere with your sleep. Some migraine medications have caffeine in them and you don't even realize it. Stimulants have caffeine in them, a weight loss pill. Decaf coffee actually has caffeine. The colas, you may notice that Coke has caffeine-free brand. That's because the regular Coke does have caffeine in it. Mountain Dew is another culprit. Chocolate ice cream, coffee ice cream, anything that you may have before you go to bed like that can cause you to lose some sleep. Some medical conditions that are linked to sleep disorders: heart disease, heart failure, obesity, diabetes, high blood pressure, stroke, depression. As far as heart disease goes, we have a fight or flight instinct. It's our sympathetic nervous system, and it reacts to times of stress. And if we are really not sleeping, that's a time of stress. Our blood pressure will go up, your heart rate will go up, hormones are produced. All of these affect the intima of your blood vessels, making them more fragile and more of a chance of building up plaque and that's how it's related to heart disease. Diabetes, you can become more insulin resistant when you're under stress and have insomnia. As adults, we need about 7 to 8 hours of sleep a night. There's a thought that elderly need more sleep. It's not true. Often they do get more. What happens in the elderly when they have trouble sleeping is that they're more easily disturbed by the light and by noise and also by pain. Routinely losing sleep or choosing to sleep less than you need is called sleep debt. The total sleep loss adds up. You're more at risk of falling asleep at the wheel or dozing off during the day. The total sleep loss is called sleep debt. For example, if you lose 2 hours of sleep per week, by the end of the week, you'll have 14 hours of sleep debt. Our normal sleep pattern is midnight to 7 a.m. And then there's another time in the day where your body wants to rest, and that's between 1 and 3 in the afternoon. So you may notice that after lunch you may feel a little tired. Maybe when you're driving you feel a little dozy, but that's because that's a natural time for your body to want to rest. Can we make up for that lost sleep? No. A nap may provide a short-term boost in your alertness and performance, but it doesn't provide all those benefits that you do get by having a good night's sleep. I love this picture. Somebody sleeping on the job. But that's another example of, being late for work and not being as productive as you could be. And that will definitely interfere with your life and your wage earning. Are you sleeping your days off away? This could be a sign that you're not getting enough sleep. This extra sleep may make you feel better, but it's definitely upsetting your sleep-wake rhythm. Sleeping when your body is ready is very important. We don't want to interrupt our sleep. And like I said, your natural body clock is that midnight to 7 and 1 to 3 in the afternoon. Sleeping when your body is ready is very important. We don't want to interrupt our sleep. And like I said, your natural body clock is that midnight to 7 and 1 to 3 in the afternoon. Insomnia is one of the most common reasons for people visiting their doctor. And many people ask for medications when they come in. A lot of us have gotten caught up in thinking that a medication is something that we need for all of our ills. And one of the purposes of this demonstration today is to give you ideas of different things you can do to help you sleep rather than just taking a pill. Previously, it was thought that insomnia was secondary to a medical condition. And if we improved this underlying condition, we would treat the insomnia. But the new thinking now is that insomnia actually makes you more at risk for some long-term chronic medical conditions, as we spoke about earlier, the diabetes and the heart disease. So still, if maybe you have asthma that's out of control and you're having shortness of breath during the night, that's a perfect example of having a medical condition that we can treat, and then you'll get a better night's sleep. You may have some congestive heart failure where at night you may be building up a little bit of fluid and you may have to sleep on a few pillows. If you get that under control with your provider, then you may get a better night's sleep. But what we're really thinking about now is getting the insomnia under control to prevent these other chronic illnesses. As I said before, you become more insulin resistant with diabetes. What are the risks of not treating insomnia? We've already talked about many of them. You have a decreased quality of life. You have a risk of some psychiatric symptoms and substance abuse. You may notice people may say to you, you seem off today. You always seem to be tired. You may start feeling anxious during the day. These are all things that you will be able to get under control. Decreased performance, and again, those risks of cardiovascular complications. What are your treatment options? First, again, we're going to treat those underlying conditions that may contribute to insomnia. But now we're going to talk about some more behavioral therapies: sleep hygiene, stimulus control, sleep restriction therapy, cognitive therapy, and cognitive behavioral therapy. And we're going to get into each one of those. Of course, there's medication, but what is mostly recommended is a combination of medication and cognitive therapy, with the goal of weaning off the medication as you go through the cognitive therapy. And all cognitive therapy is getting some counseling. Sleep hygiene. These are just all actions that tend to encourage a good night's sleep. Many of them sound like common sense, but it's always worthwhile to look at your bedroom. Stick to the same bedtime and wake up time, even on weekends. We definitely discourage you from sleeping late on the weekends. Practice a relaxing bedtime ritual. Do some relaxation techniques. We're going to talk about those. Read. Try not to fall asleep with your book. Just read until you feel tired, and then put your book down and try to go off to sleep. Avoid naps, especially in the afternoon. If you're going to be napping for 4 hours, you're never going to get a good night's sleep, because you've just gotten half of your sleep needs during the day, and we're constantly trying to catch up. Exercise every day. If you don't have to be on a treadmill, you don't have to be on a bicycle, just go out for a walk. You might try some swimming, anything that gets you out and moving. And we realize that, many people, as you get older, you do have some mobility problems. Talk to your provider, talk to your family and friends, see what other people might be doing. That's something that you could participate in that would help you get that exercise and be tired at night. Going out during the day will also help with your circadian rhythms. We want you to get a good amount of sunshine during the day, so your body knows that you have the sunshine during the day, and then you darken your room at night and prepare for sleep. Sleep on a comfortable mattress and pillow. Again, sounds like common sense, but think back. How long have you had that mattress? Try to replace your pillow once a year. They do flatten out, and you don't get that good night's sleep. Think about when you wash those sheets and you can't wait to get into bed that night, because you just know that your bed's going to be nice and comfortable. Evaluate your bedroom. What's the noise level? Do you have a TV? We definitely do not want you to go to sleep with the television on. All that noise, the talking, the lights of the TV, prevent you from getting into that deep sleep that you need. Having a computer in your room, there's all kinds of lights blinking on many computers, and maybe some noises again. Do you have a nice room darkening shade? Do you have clutter in your room? Sometimes if your room is very cluttered, it's unsettling. Try to look at all these things. Avoid alcohol, cigarettes, and heavy meals in the evening. Think about when you have a heavy meal, you're going to feel very bloated. You may have some heartburn. All of that is going to affect your sleep. Alcohol is a depressant, and it definitely interferes with your sleep. It changes your breathing pattern and makes you more at risk for sleep apnea. Wind down. Do a calming activity before you go to bed. You might turn the radio on to some music. Many of the smartphones have Pandora that's free. You could put on, they have yoga music. It's very soft, relaxing music you could put on, or whatever type of music you like, some jazz music. If you cannot sleep, go into another room and do something relaxing until you feel tired. Worrying is a very common cause of sleeplessness. And the next technique that we're going to talk about is stimulus control. You're going to use this technique when one associates the bedroom with the fear of not sleeping. Many of us, you don't sleep, and then you get really anxious because you want to fall asleep, but you're not able to. So don't go to bed until you feel tired. Use the bed primarily for sleeping, not for reading. Try not to use your bed to do everyday life things. Like, don't eat in bed, don't watch your television in bed. And there's even a thought that you shouldn't read in bed. You should read until you feel tired and then get up and go to bed. You should not lay in bed for more than 20 minutes awake. And with this technique, what we'd like you to do is, if you are awake for more than 20 minutes, leave your bedroom. Do some relaxing activity, like reading, listening to the music. Avoid stimulating or rewarding activity, like eating in the middle of the night, getting up and turning the TV on. Don't return to bed until you feel tired. You're going to go back in and you're going to give it another 20 minutes. If that still doesn't work, you're going to get up again and start the process over. A key to this technique is to set your alarm to wake up at your regular time. You may not see improvement immediately, but the accumulated sleeplessness will facilitate the sleep during successive nights. So this is something you want to talk to your doctor or your provider about before you do start doing something like that, or the sleep restriction therapy. This next one we're going to discuss is sleep restriction therapy. Some people stay in bed longer to make up for longer sleep. So for instance, you may be in bed for 10 hours a night but only get 5 hours of sleep. We call that sleep deprivation. It causes a circadian shift, a decreased sleep drive that makes it more difficult for you to go to sleep the next night if you were in bed so much longer. So then the result is the next night you're in bed even longer, trying to go to sleep. What is the goal of sleep restriction? It's to consolidate your sleep time and increase your sleep efficiency. Sleep efficiency is the amount of time that you are in bed sleeping. We encourage you to use a sleep diary for this. Sleep diary will be used to report the amount of time that you are in bed and the amount of sleep that you obtain. Your provider will compute your sleep efficiency by dividing your time of sleep by the amount of time that you're in bed. So for instance, sleeping for 4 hours and you're in bed for 9 hours, you're only going to be 44% sleep efficient. The goal is to be above 85% sleep efficient. For the elderly, the goal is 80%. This technique is most effective for people who sleep over 8.5 hours with a sleep efficiency of less than 75%. So if you're in bed, have trouble, there's two different types that you can have trouble falling asleep. You may be in bed for 2 hours before you fall asleep, or you could wake up at 1 o'clock in the morning and be awake till 4 o'clock in the morning. That would be another example of not getting your sleep. The goal is to limit your amount of time in bed. So you're going to stay in bed only for the amount of time that you're sleeping. You're going to review your diary with your provider, and what you will do is, once you have gotten to the point where you are only in bed while you're sleeping, then you can increase your time in bed by 15 to 30 minutes each night until you are at that sleep efficiency number of 85%. And you're going to repeat this until you get a good night's sleep without daytime drowsiness. The key to this is there's no napping allowed, and also to work with your provider. I love this slide. Many people are stressed out and sleep deprived. Many, I believe it's 60% of doctors' visits are related to some type of stress. And of course, insomnia is a big reason for people to see in their providers also. I'm going to talk now about some relaxation techniques that you can use when you're trying to get to sleep. One is progressive muscle relaxation, and the second is a relaxation response technique focusing on your breathing. Progressive muscle relaxation, you're going to lay in bed, and both of these are techniques you can use not only at bedtime but during the day when you're feeling stressed, or just each day. It's good to use one of these techniques for just a few minutes just to relax your whole body. For the progressive muscle relaxant, you're going to sit in a chair or lay in your bed at bedtime. Relax your entire body, and you're going to start at your head, and you're going to tense up your muscles for just a few seconds at a time and relax them. You're going to start with your face. You can scrunch up your eyes, relax your eyes, then go down to your jaw, and tighten up your jaw, and then relax it. You're going to follow this all the way down to your neck, your arms, your abdomen, your hips, your buttocks, right down to your toes. And you're going to repeat this more than once. And again, it takes patience and it takes practice. You're not going to get this technique on the first try, but you will be surprised with practice that you will find that you will be able to relax with this technique. And it may just take 5 minutes. It may take you a little longer, whatever it takes to get you to relax, to go to sleep. The relaxation response, again, what this does is it allows your body to totally relax. You're going to lay in your comfortable spot with your eyes closed, and you're going to allow that relaxation to spread through your body. Start with some controlled abdominal breathing. You should start with your hands on your belly and note the in and out of your breathing. You're going to note when you inhale, your belly pushes out towards your hands, if your hands are on your belly. And when you exhale, you'll feel the relaxation in the muscles in your belly. Concentrate on this breathing pattern. Focus on it. As you're doing that, you're going to be trying to redirect all those everyday thoughts away to a neutral mental focus. You're going to use a peaceful word or an image. The word could be peace, it could be forgiveness, it could be grace, whatever word has some meaning to you. The image could be the sounds of the ocean, or a beautiful sunny day, or being out in the woods, the laughter of your grandchildren, whatever that peaceful focus is for you. And again, practice makes perfect. Give it at least 5 minutes of just trying to use that breathing to redirect those thoughts and get into that mental focus. Just going to take a moment. We're going to talk about cognitive therapy. Worrying about poor daytime, lack of sleep causes further sleeplessness. We may tend to catastrophize, blame all problems on our sleeplessness. One recommendation is to work with a therapist to try to deal with your anxiety and your negative thoughts and develop realistic expectations related to your insomnia. Many of us have what we call cognitive distortions. That's when we mentioned here that you may catastrophize. The distortion is in your thinking. A problem that you may have, you may make it seem like it's bigger than it really is. You may magnify it. We may jump to conclusions, and we may tend to be a perfectionist, and everything has to be perfect. I think we all know in life that everything cannot be perfect. Some of us think in black and white. That's another cognitive distortion. Everything cannot be in black and white. Couple of red flags that you might think about. If you start using the words like you must do this and I should do that and I always get in trouble when I do that and never and ought, those tend to be negative thoughts. If you can change your I should do that into I would like to do that or I want to do that, and your I must to I can, then what you're doing is you're changing those cognitive distortions into a more positive thinking, challenging those negative thoughts. We recommend you stop, take a deep breath, reflect on what you're thinking about, and then make a choice to try to think more positively about it. Humor is another way of dealing with stress. You may hear, I hear often when people are under stress, someone might say to you, you've lost your sense of humor. And optimism is also a very positive trait. Optimists are seldom surprised by trouble. Optimists look for partial solutions. We talked about black and white and all or nothing. We're just setting ourselves up for failure if we think that we're going to solve every problem completely. Keep your trains of thought positive. Be appreciative and support and empower yourself and share good news. An optimist accept what cannot be changed. So those are just a few things that are food for thought. Cognitive behavioral therapy. This is something that we've discussed in this office, and what it does, it combines all of these strategies that I've just spoken about. We would have weekly group or individual sessions. We might take a week to talk about stimulus control, another week on sleep restrictions, couple of weeks of cognitive therapy. You may have some one-on-one cognitive therapy, a week about sleep hygiene, and then we may have a final session on stress and relapse. What do you do if you had insomnia, you seem to beat it, and then you relapse? Using a sleep diary, that's very helpful because the results are measurable. You can see how you've improved since when you started trying to overcome this burden. Cognitive behavioral therapy is considered to be a great way to go about doing this because it integrates all of the different therapies. It does provide you tools that you can use in the future, and again, the results can be measured. The disadvantage is you're signing up for 6 weeks and making a commitment, and few clinicians are skilled in all of these components, but in this office we're very fortunate that we do have a psychologist, nurse care manager, providers, the physicians and the nurse practitioners all working together with you to try to help you get a good night's sleep. Insomnia is a clinical diagnosis. When you see your provider to discuss it, he'll do a complete, or she will do a complete medical history and a physical exam, just to rule out there is no physical reason for this insomnia. And then you'll discuss all these different options. Cognitive behavioral therapy for 6 to 8 weeks. We're talking about medication. What we'd like to do with medication is to add the cognitive behavioral therapy with it, with the goal of weaning off the medication. Short-acting medications tend to be used for sleep onset insomnia. Long-acting medications tend to be used for sleep maintenance. That's when you're not able, once you go to sleep and you can't stay asleep. What are the downside of medications? Side effects, daytime drowsiness. We already have that because we have insomnia. We don't want to add to that. Impaired driving, dizziness, lightheadedness, interactions with alcohol and medications. Most of these medications are cleared by your liver and your kidneys. Many elderly folks already have some problems with those systems. We have to be careful with prescribing them. They can worsen the symptoms of other diseases. COPD is an example. And they can't be used for someone who needs to wake up alert, as in that first responder or the caregiver. What medications do we try for insomnia? Melatonin is a popular one. It is over the counter, or you can get a prescription. Herbal medications, antihistamines, diphenhydramine, that's Benadryl. Some people actually have an opposite reaction when they take Benadryl. Rather than it makes them drowsy, it can make you hyper. So that would be another consideration. We use antidepressants. Some of the antidepressants we use just because a side effect is drowsiness. But there are specific antidepressants that can be helpful. The benzodiazepine, lorazepam is an example of that. The non-benzos would be zolpidem, that would be Ambien. You may have heard in the news that that comes with its own side effects of some amnesia. There's been some discussion of people actually getting up and driving and not realizing that they did that. Medication is not recommended for long-term treatment of insomnia. That's a big take-home from this whole discussion. There's been some new medications introduced. They promote wakefulness and regulate your sleep-wake cycle. They've recently been approved by the FDA, but another side effect of those is daytime drowsiness. So the point is, all of this treatments need to be discussed with your provider to see which you may think is right for you in conjunction with your provider. To end, I just wanted to leave you with some community resources that may be helpful. We have senior centers. They have exercise classes, yoga classes. There's social workers available. Maybe you're having problems with your financial. There's senior elder care social workers. You may have a case manager with your health insurance. We have nurse case managers here in the office. Maybe your diabetes is out of control. You can meet with her and she can help you with that. Your health insurance may have a discount on a gym membership. The Point is a central clearinghouse for elder resources. You can look that up online. You can call 211 and they would give you access to that. The library. There's many classes at the library, books in print and audio books. Your town recreation department, the YMCA has all kinds of exercise classes, water aerobics. Warwick Community Action. That's where you could go to for any financial. They have different programs for people who are under a certain income limit, and that might help you with your worrying at night that's keeping you from sleeping. Community mental health centers. They have psychologists, psychiatrists, and if anxiety, depression, mental illness is something that you really need to get under control, that's a great resource also. So I hope that something from this program may have an aha moment or a light went off and you realize that you do need to get some help. Talk to your provider. There's a lot of information out there on the internet, at the library. Just do a little bit of reading. Something may click with you. So thank you very much for your attention, and I hope you get a good night's sleep.